My name is Tiffany Collins and I'm 14 years old. I was very surprised to hear that I was the 500th transplant at Stanford Children's Health. I've never thought of how many surgeries they do, and that's just heart transplants. It was very surprising, but I'm glad and very proud to be the 500th transplant.
For me, the 500th heart transplant here at Stanford Children's Health is an incredibly important milestone. In terms of the past, it really says something about the legacy that has been built here over many, many years of excellence. I think for the present, it tells me and motivates me and the rest of this team, all of us, to continue to push hard far into the future so that we can help the next 500 children that need therapies like these.
I first met Mackenzie when she was admitted to our intensive care unit with dilated cardiomyopathy.
Beginning of February, Mackenzie started to lose her appetite. The appetite got worse. Then she started vomiting, and we took her to our pediatrician, and they tested her for COVID, obviously, and it ended up coming back negative, and they said it was just a virus in 7 to 10 days. We went back the following week because she had also developed a cough, and she would complain that she couldn't breathe. So that second week, we did a chest x-ray, which came back clear. And then week 3, she started swelling in her feet. And of course, this is a Friday, late afternoon, pediatrician office is closed. Run down to doctors on duty. They sent us straight to our local hospital. So within an hour, they said that she was in congestive heart failure, and they reached out to Stanford Children's, and within an hour, a cardiac ambulance was on their way down to us to pick her up, and we were up there. It was a huge shock to us. We had no history of heart disease in our family. She otherwise was a perfectly healthy teenager.
Before her admission, she had not known that she had any heart disease, which may sound strange, but is actually fairly typical for dilated cardiomyopathy in teenagers.
It turns out that she has a gene that mutated and caused the dilated cardiomyopathy. It's just such a state of shock. You have a perfectly healthy child 1 minute, and the next minute they're talking about doing heart surgery.
Her heart muscle was very stretched out and wasn't squeezing well. We used IV medications in the intensive care unit to try and help her heart function, but she continued to have progressive symptoms, and she started to develop some abnormal heart rhythms.
Mackenzie actually underwent 2 major operations with us. She had a durable ventricular assist device placed to help support her heart in the springtime, after which she was very well supported for a number of months before she ultimately underwent heart transplantation with removal of the ventricular assist device.
To care for a patient like Mackenzie requires an enormous team. We have bedside nurses with great expertise in the ICU, anesthesiologists, surgeons, cardiologists, and after transplant, a whole new team, including our transplant social workers, advanced practice providers, and transplant cardiologists.
We offer a wide variety of therapies for patients who are afflicted by advanced heart failure. Ultimately, we are able to tackle some of the most complex cases that really are not attempted even at other centers.
Dr. Ma opened her up and put the LVAD in, and that started the recovery for her. They took such a genuine interest in Mackenzie. Everybody was great with her. Mackenzie had her room decorated with pictures of her cats, and they all knew the names of her cats. They knew the names of her friends from pictures. And when we came back for transplant, they remembered her. You just can't get that anywhere else. Stanford Children's Health has a reputation of excellence. There would be no other place I would go for either of my daughter's care. Today, you would never know that this child had 2 open heart surgeries in a 6-month time frame. She is swimming. We walk daily. Her energy level is pretty much back to 100%. She can do everything she did prior and probably better. We just didn't realize. For her to be such a success for Stanford's 500th transplant is just a miracle.
The Betty Irene Moore Heart Center transplant team is really remarkable in that we're one of the largest volume, both pediatric heart transplant and VAD programs in the country. And so what may be rare at other hospitals and even other specialized children's hospitals becomes more routine at our hospital because we deal with such complex cases on a regular basis. We have such a wonderful team who all contribute to the care of our patients. We all are able to work well together to provide the best care for our patients.
I am very grateful and thankful that they took such amazing care of me, both medically and mentally. It's amazing that I got my heart transplant so soon because I could get right back to doing all the things that I love.